And I was shocked. I looked at it and I was like, oh my God, this looks terrible. This must be the most uncomfortable condition that you can have. I basically started to say, you know, was this from, and before I could even finish my sentence, he was like, no. And I remember so clearly the fear on his face. Hi, this is Dr. Philip Young. We're Aesthetic Facial Body Plastic Surgery and the Beauty Docs on YouTube. If you enjoyed watching this, click the like button below. Hi, this is Dr. Young, and this is the second installment of the topic in the video series Plastic Surgery Stories. And the first story I want to talk about is my experience when I was in LA County Hospital doing head and neck surgery. And this is during my intern year, and basically doctors go through a year where they experience all types of surgical specialties during their first year to kind of get a general perspective about how other specialties work, and how and I think that basically helps you understand some basic things so that when you do your specialty, you can be able to recognize and also work with other specialties. So this is during my time when I did a rotation in colorectal surgery. And basically that's a specialty, it's a surgical specialty that deals with the colon and rectum. Specifically during that time, I remember a stint that I had to take care of jail inmates for the LA County General Hospital. And I remember a particular story because it was kind of gruesome, and the person related to this really stuck in my mind. So anyways, I go up to the jail ward on LA County, and I see this basically small Caucasian kid, and I go and look through his chart, and I usually start out by asking, how you doing? How can I help you today? And basically said, he wasn't really too verbose, and he said, well, I'll show you. And he basically turned around and pulled down his pants and showed me his rectal prolapse, which is essentially the insides of your body coming out and rolling out. And I was shocked. I looked at it and I was like, oh my God, this looks terrible. This must be the most uncomfortable condition that you can have. And during my time when I did the jail rotations, I often find it really curious it was really curious for me to find out like how they got there, whether they actually did the crime or not. And in this particular situation, I wanted to ask him how this happened. I basically started to say, was this from, and before I could even finish my sentence, he was like, no. And I remember so clearly the fear on his face. It was palpable. I could just feel the intense fear this person had. And from that moment on, I was like, I'm always gonna obey the law. I'm never gonna do anything that's gonna lead me to get put in jail, because this guy looked like he was in such a state of hell that it just stuck in my mind. Anyways, hey, so this is my second story as part of this second installment of Plastic Surgery Stories. And this one has to do with my rotation in neurosurgery. So during this period, I was exposed to a lot of head trauma. Some of that included gunshot wounds to the head. And I do remember a particular story that I like to share that I think you might find interesting. This involved a young Hispanic male in the LA, greater Los Angeles area. And first, what I noticed in LA was that a lot of the gunshot wounds and crimes did involve a lot of Hispanic or people of Hispanic descent. And this particular kid was about 18 years old. And it was a fascinating story about head trauma, which I had no idea. This kid came in and was apparently at a party, and he basically got in an argument, and some guy came behind him and put a .22 pistol right at the base of his head and shot. And this bullet, smaller caliber, actually went through into his head and crossed the hemispheres of the brain. And usually I was told by the neurosurgeon that was above me and kind of controlling the team, is that when you get the sign that the bullet has crossed hemispheres, the likelihood of survival is almost zero. But the funny thing is, when this kid came in, he was totally aware. I mean, it wasn't like he was in a coma or anything. I remember when I was in the ICU, he had his tube in his throat, a breathing tube, because they had to protect his airway, because when you get shot in the head, you're gonna likely lose consciousness and stop breathing. I remember him totally aware with a tube in his mouth saying, "Take this out." He would scream at me, trying to scream at me, but it's hard to scream with a tube in down your throat. He would say, "Take this out." And I would think to myself, oh my God, he's totally awake with the tube down his throat, and he had just been shot through the head, and he's totally able to have this conversation talking to me. And I thought, this is so odd. I can't believe that someone who gets shot in the head and it goes across the brain is able to be totally with it. And the funny thing is, he, for an hour or a couple minutes or a few minutes, he was totally awake, totally normal, able to say, "Take this out of my mouth. I want it out now." And then the next minute, he would be totally out, totally unconscious. And it just really, really stuck in my mind that it was so amazing that he was able to be conscious. And I remember when he first got there, we took him down and we wheeled him down to go to the OR. And I remember all his friends were there just screaming like, "Get up, get up, get up." And it was just a really surreal experience. Anyways, something that you may not have known, and thought you might enjoy that particular story. Hi there. So I have another story, and it has to do with people with diabetes. There's probably not common knowledge, but diabetes has a huge effect in all of your systems, because sugar is like the basic energy source that we ultimately break down for the cells to use. And so because diabetes has to do with processing sugar, it has very widespread effects in the body. Now, some of the things that diabetics have to deal with is that they have a predilection to have infections. And the reason is, there's a lot of different reasons and thought of why that is, but the extra sugar appears to involve or interfere with the function of these white blood cells that fight infections, as well as just normal processing of inflammation and fighting infections. One thing that people probably never heard of is what they call diabetic fungal infections. And since I was working in the head and neck surgery, we dealt with the fungal infections that occur in the face. And I wanted to share some of those stories. Now, when patients come in with really bad sugar control and they have some sort of sinus infection, what happens is that they get immunocompromised and they start getting infected by things that normally don't infect a normal person. For example, fungal infections. There's a type of fungal infection that can be just extremely aggressive in a person with diabetes. And I remember many times where people would come in with these sinus infections, and we would literally have to just keep monitoring it every day to make sure that it doesn't advance. And what we would be looking for is black tissue that would be dying. And we would have to scope the nose to find out how much it's progressed. And sometimes these fungal infections would literally eat away the sinuses, and it would extend into the brain. So we would have to go in there with scopes, and we'd have to look inside to make sure there's no black areas. And if it was significant, we'd have to take them to the OR to debride it or to remove the dead tissue. Otherwise, it would get worse. And it was about like fighting the sugars being out of control. It would be antifungals through the IV, through the intravenous route. And so just sort of a knowledge of this. Sometimes patients with diabetes can have really bad fungal infections that can literally attack the brain and just basically kill you. So make sure to watch your sugar control. Don't get diabetes. Related to this idea is a study on vegetarian diets. This guy that was really well known for being an advocate for a vegetarian diet did this double-blinded, placebo-controlled trial and showed that the people that are actually on these vegetarian diets actually weren't doing better than people that were eating less vegetarian diets. In fact, the people that were on vegetarian diets were actually dying early. And this is in a Malcolm Gladwell revisionist history podcast, and which I thought was fascinating. So the thought is that the vegetarian diets had a certain fatty acid that humans weren't used to, and that fatty acid was the cause for more inflammation in the arteries that would lead to more heart disease. So don't always think that a vegetarian diet is going to be the cure-all. And how is that related to sugar? Well, when they looked at all the studies again, they found that the one common denominator that could be a predictor of a life that doesn't last as long is sugar. The people that ate more sugar tended to be the people that had a decrease in life expectancy. So diabetes and sugar in general is probably not a really good thing. So anyways, my other story has to do with a psychological disease where people have a tendency and a desire to ingest non-nutritious items. For example, like metal things and objects. And we had this patient in LA County who constantly had issues where she was brought to the ER for us to take care of. She would swallow all sorts of things. She would swallow watches, metal, like spoons, and all sorts of different metal objects. In fact, she would come in and we would do an x-ray, and she would have all these things in her stomach that would be around in a circle like the gut. And sometimes they would get stuck in the esophagus, but once they passed into the stomach, a lot of times they would pass through. And then it would be a different situation for another specialty. But when we were called, these objects were stuck in the esophagus, where we would have to go in and remove them. And I remember the times that we had to do it for this particular patient, because she was really a common visitor to our specialty in our department. And I remember one time where she actually swallowed a spoon and it was in her esophagus, and we had to take these endoscopes, these esophagoscopes, where we would elevate the esophagus, and then we would go in there and basically pull out these objects. And one time I remember we did this for her, and she was being wheeled out into the recovery area, and before we knew it, she grabbed another thing and swallowed it again. And so we had to bring her right back. And I remember after that, all the residents would say, after you do this procedure on her, don't let her grab anything. Tie her up, because we have to make sure she doesn't swallow anything from the operating room to the recovery room or any other period of time when she's in our care. So I thought that was a really interesting story. I have another story that is fascinating in many different ways that I wanted to share. I think that during our medical school education, we learned about certain things. For example, in particular, what I want to talk about is the relationship of the husband and wife. And I guess it's common knowledge for many who look at crime stories, etc., that whenever a husband or wife is killed, they always look at either the husband and wife as the primary subject. And the thought is that, well, why is that so common that occurs? Because they're supposed to be either in love and they have a great relationship. And if you're married, you probably know that, sometimes it's not, it's not all rosy in those situations, in those relationships. But I think during medical school, we kind of learned why that is. And what I found fascinating was the fact that they talk about love and hate is very similar in many regards. For example, in hate and love, you have your heart rate races and you get some of the same sympathetic responses and parasympathetic responses and your basic bodily functions that indicate that you're having those feelings. So sometimes love and hate have very similar physiologic actions in the body, and it's really just the knowledge and the upper brain part of it that knows, well, this is love and this is hate. And so they found that this close relation is part of the reason that when tempers flare, that love can easily transform into hate. And you might even know this from different readings that's not related to medicine, that love and hate is there's a thin line between it. And I think that's a common saying. But I remember during my head and neck surgery times and experience that I saw many things that happened in those relationships. For example, one time I had this lady screaming when she came into the ER because she was basically cut across the face from here to here, and it was deep and it was spread open like this. And she would tell me, "Oh my God, doctor, I knew there's something wrong with that guy. I just knew it when I met him. And then when he got mad at me, he just took a knife and just slashed me in the face." I've seen so many women that have had that encounter, and I've had to fix those patients. I remember this one lady that came in, and they lived in the little outskirts of the Los Angeles area, and they were kind of in the wooded area. And I remember this lady who came in literally with a machete in her head, and it didn't penetrate the brain completely, but literally it was in the head, and we had to remove it. And another person at another rotation where this guy basically got stabbed by his wife or his girlfriend because they got in an argument, and literally the lady took a knife and put it all the way into his stomach, and he had it just to the hilt, but he had no serious problems. And I just remember asking him, "Oh wow, what happened?" He goes, "Man, she got me good. We got an argument. She stuck me all the way." And it's those stories that like stick in my mind. I remember these people's faces like so clearly. Anyways, kind of a different outlook at the marriage and the significant relationship kind of thing that I see from a medical standpoint. Thanks. We would love to have you subscribe to our YouTube channel. We're the Beauty Docs. We're going to be coming up with insightful videos showing you a glimpse into our lives in plastic surgery. Specifically, we're going to show you the human side of what we do. Through that, we hope to enrich your life as these experiences have enriched ours. Click the following annotations to subscribe and be the first to see these unique videos on our YouTube channel. To learn about our theory on beauty that helps us get you the best results, to see a new video showing you the relationship between holidays and heart attacks, or to see a story about plastic surgery and hope in our patient with an autoimmune disease who then developed cancer during our treatment. Again, thanks for watching, and we'll see you next time.